This is my video discussion on our joint types. I'd like to start off with defining the word joint. Joint is basically any two bones that meet, whether the bones are mobile at the interface or not. In our textbook, there are 4 major joint types that were listed, and those 4 types are bony, fibrous, cartilaginous, and synovial. Hopefully I pronounced those words correctly. To start off, I will talk about our bony joints, or also known as synostosis. A bony joint is an immobile joint formed when the gap between 2 bones ossifies and they become a single bone. Bony joints can form by ossification of either fibrous or cartilaginous joints. The textbook uses infant as an example. So the infant is born with a right and left frontal and mandibular bone, which then forms into a single frontal bone and mandible. Okay, our next joint is fibrous joint, which is also called a synarthrosis. It is a point at which adjacent bones are bound by collagen fibers that emerge from one bone, crosses the space between them, and penetrate into the other bone. There are 3 kinds of fibrous joints: sutures, kyphosis, and syndesmosis. In both the sutures and kyphosis, the fibers are very short and allow for little or no movement. And in syndesmosis, the fibers are longer and the attached bones are more mobile. So in our textbook, there were 3 examples, one example of each of these. So the sutures on the skull are immobile or slightly mobile joints that closely bind the bones of the skull to each other. So here I basically took the picture from the textbook and just drew it out, but this is basically the skull and then the suture which connects the bones of the skull together. And then the next picture, it's the attachment of a tooth to its socket, which is classified as a joint called kyphosis. This allows for the slight movement of the tooth, such as chewing and biting. The picture from the textbook shows the teeth hair and the jaw hair, and then the fiber that is connecting both of them together. And then our next one is the syndesmosis, and the most common joint is the tibiofibular joint, which is located at the lower end of the tibia and fibula bones in the lower leg. It is to provide stability and prevent excessive movement between the connected bones. So that's my drawing. Okay, so our next main joint is cartilaginous. In these joints, 2 bones are linked by cartilage. A cartilage is a flexible, strong connective tissue that cushions joints, provides shape, and supports other tissues in our body. There are 2 types of cartilaginous joints that were mentioned in our textbook, and they are synchondrosis and symphysis. A synchondrosis is a joint in which the bones are joined by hyaline cartilage, whereas in symphysis, 2 bones are joined by fibrocartilage. So an example of synchondrosis is the attachment of the first rib to the sternum by the hyaline costal cartilage. So this is the sternum and these are the ribs, and the little red part is the cartilage that attaches it to the sternum. And an example for symphysis is the pubic symphysis, which connects the right or the right and left pubic bones. And this is also known as the interpubic disc, but in this case it's the fibrocartilage. So those are the two examples. So our last main joint is synovial joint. They are freely movable joints that allow for smooth, low friction between bones. An example would be your elbow, your knee, or your knuckle. So in the drawing I did here, this is the knee or the kneecap. The blue colored part is the joint cavity, which allows for the knee to have movement. So the two bones and then the joint cavity, and it allows the movement of the knee. So that wraps up my 4 main joint types video. I hope you guys enjoyed it, and please excuse me for the wrong pronunciation on some of these words. So yeah, thank you.